Okay, we'll go ahead and get started. Good afternoon, everyone. I am pleased to welcome you to the Feeling Your Best with Bronchiectasis Airway Clearance webinar with Bradley Boynton, registered respiratory therapist and clinical specialist at the Mayo Clinic College of Medicine and Science in Rochester, Minnesota. My name is Christina Hunt, and I am the director of bronchiectasis and NTM research and education, and I will be your moderator today. This webinar is being recorded and will be made available for future viewing. Before I get started, I wanted to mention that we'll be muting your microphones throughout the presentation. If you're new to the Zoom platform, you're going to notice a bunch of icons down at the bottom of your screen. Throughout this webinar, we're going to leave your mics muted, but if you have any questions that you would like our expert to answer, I invite you to use the Q&A feature to submit them. You do so by clicking on the Q&A icon and entering a question in the box. We will try our best and get to as many of your questions, although we do have quite a few people registered for this event, as we can at the end of the presentation. We have organized this webinar for patients and caregivers so they can feel their best and better manage their bronchiectasis by knowing more about airway clearance. On July 1st, 2022, we declared World Bronchiectasis Day to be observed annually. World Bronchiectasis Day aims to raise global awareness, share knowledge, and discuss ways to reduce the burden of bronchiectasis for patients and their families worldwide. We are very excited to be celebrating World Bronchiectasis Day again in 2023. We thank our community for their support of this day, and if you're curious to learn more, I invite you to visit www.worldbronchiectasisday.org. And without further ado, we will begin the webinar. I want to start out by introducing our presenter today. As mentioned, Bradley Boynton is a respiratory therapist and clinical specialist with the Department of Anesthesia and Perioperative Medicine Respiratory Care at the Mayo Clinic in Rochester, Minnesota. Brad received his Associates of Respiratory Care from Rochester Community College, Mayo School of Health Sciences in Rochester, Minnesota. He received a Bachelor of Science degree in Health Administration from the University of St. Francis in Joliet, Illinois. He has been practicing as a respiratory therapist for more than 25 years. Bradley currently works in our outpatient pediatric pulmonary, aerodigestive, cystic fibrosis, ALS, and adult bronchiectasis clinics. He currently serves as co-chair of the Legislative Committee for the Minnesota Society of Respiratory Care. Welcome, Bradley.
Hi, everybody. Boy, I see on the participant list that there's 205 of you here. This is fantastic. Christina told me there were going to be a lot of people, but I didn't realize there were going to be that many. So welcome, everyone. Christina called me an expert. I'm not so sure I'm an expert, but I guess I'll take that label for today. I do work, about 85% of my job is dealing with airway clearance and educating patients on how to do some of these things. And you all see that there are a lot of techniques out there. So that's what we're going to talk about today. We're going to review all these techniques. You can put questions in the question and answer. Kind of the way I'd like to do this today is kind of go through the slides, talk about all these techniques, and then we should have plenty of time for questions and answers at the end. So I think that's how we'll handle this today. So when we talk about airway clearance goals, I kind of found this slide on the COPD webpage, and I kind of like this slide because, the goals of airway clearance, I feel there's 6 main goals. We're going to splint the airways open with techniques. So we're going to move mucus from the small, tiny little distal airways to the larger airways so folks can cough them out. And we can improve airflow velocities, better known as peak flow. We can interrupt the cycle of tissue destruction. We can decrease infection and illness, hopefully, and we can improve quality of life. So those are kind of the goals of airway clearance. And a lot of folks talk about the vicious cycle, right? You get an infection, you get inflammation, you get airway damage, And I would actually add to this little vicious cycle circle, impaired mucus clearance. So infection, inflammation, airway damage, impaired mucus clearance, and then the cycle starts over. So this is exactly what we're trying to break. We're trying to break this cycle by using airway clearance techniques. And here's a list of some of the airway clearance techniques that we're going to talk about today. The first couple are the ones I like to refer to as insurance companies like these because they're very cheap, or in other words, you don't need anything for them, you just do them on your own. And then as we go along, we kind of get into some more of the higher technology type things for airway clearance. So we're just going to go through each one of these one at a time. The first one, autogenic, easy for me to say, autogenic drainage. The word autogenic literally means self. So what we're talking about here is self-drainage of mucus from your lungs. And this is a great technique because it doesn't require anything except you, right? So this little graph on the side here kind of tries to give you a visual representation of what you're actually going to try to do with this technique. And really, you see that we're going to unstick the mucus first from the smaller airways. We're going to sort of collect it and move it to the medium airways, and then it gets to the big airways where we can evacuate it out. And really, this technique, some feel, is kind of difficult to teach to people. And quite frankly, it might be kind of difficult to learn. But honestly, if you have a good teacher and you have someone that's willing to do this and could do this technique, it can really move a lot of mucus. So the way I teach this, I actually use the technique right from the Cystic Fibrosis Foundation, because remember, cystic fibrosis folks also have bronchiectasis, right? So the technique that I use typically comes right from the CF Foundation, where we're going to start with sort of some breathing control. So in through your nose, pursed lip out through your mouth. I work with a lot of pediatric patients too, right? So we would tell the pediatric patient, blow your candle out, right? So in through your nose, blow the candle out. You do that twice. And then you take a big deep breath and blow all your air out all the way down. So almost all your air is out of your lungs. And then you're going to start with the small airways. And this requires you to just, after you breathe all your air out, you take a small breath in and hold it, and then exhale it, not as hard as you can, but kind of forcefully. And then you do it again. You do that 3 times. The big thing is breath hold, right? So not a big breath, just a small breath. And then after that third small breath, then you take a normal sized breath, hold it, kind of exhale, forcefully, but not as hard as you can. And then do it again. You do that 3 times with medium sized breath. And then on the last one, you take the biggest breath you can take and hold it. And then exhale, biggest breath you can take, hold it, exhale, and you're filling your lungs completely as much as you can. And then on the very last one, you really puff, open up your airway and do the huff maneuver where you tell people you have to huff hard enough that you're going to pretend like you're looking at a mirror, and you have to fog up the mirror. And then you huff all the way out until the end. Again, the idea is small breaths, medium breaths, big, large breaths, get the mucus out of your lungs. Very effective technique, sometimes a little bit hard to teach, and sometimes hard for some people to learn, okay? But again, very, very effective. And remember, it doesn't cost anybody anything. It just costs you time, okay? The next one is active cycle of breathing. And for me, I sort of combine the active cycle of breathing with huff coughing, because if you're going to do all this active cycle of breathing, I kind of think you should huff cough too. So again, it's the same sort of thing where you're going to do the breathing control in through your nose, out through your mouth, blow the candle out. And then essentially with this, it's just on the third breath, huge, big, deep breath. Again, hold your breath, as long as you can, 3, 4, 5 seconds. And then you huff out as hard and as long as you can. Sometimes with the huff coughing, people will teach Instead, I like to teach just one big long huff. Sometimes people teach people to do small little huffs instead of a long hard huff. They just do the out with quick short breaths. I say whatever is most effective for you. Okay, that's how I like to. If the long huff really moves mucus for you or makes you cough, that's great. Or if the whole bunch of huffs in a row work for you, then you should do that. I always tell people, if you do this technique correctly, as a matter of fact, when I'm trying to teach people how to do this technique in the office, even if I'm not ill or have mucus and I do this correctly, it sometimes makes me cough. So if someone is teaching you how to do this properly, it should make you cough almost every time. Okay, so that's sort of the active cycle breathing and huff coughing. And remember, this one, again, doesn't cost us anything either. It only costs you time. Okay. And this, I put this little slide in kind of right at the last minute because I think sometimes the breath hold aspect of the COP of doing airway clearance is missed by some people. And I think this little picture shows us why breath holding is so important, especially if you have, disease in the little tiny air sacs, which are kind of represented by the bubbles here. Oops, I went forward on my slide there. So if you look at this slide, it's representing the little bronchiole that comes down, and then at the end you have all your little air sacs. And what you should know is they're all interconnected by all these little channels, pores of Kahn, channels of Lambert, all these little things. So what happens is, you can see on the left side there's like an orange little blockage, and that represents the fact that maybe that little airway is blocked with mucus. So what happens when you take a big deep breath, the one on the right hand side of the screen will inflate, but maybe the one on the left hand side doesn't. So when you take a breath and you hold your breath, it actually will make the guy on the left hand, the little air sac on the left hand side, maybe inflate a little bit. So then when you actually go to cough, you have air behind that mucus and it'll get out of there. So I like to show this because that the autogenic drainage and the active cycle breathing both incorporate breath holding. And this is why that's important. We should be breath holding maybe more than some people teach people to do. So I think it's a real important concept to know. Now we get into some techniques that may or may not require some equipment. Postural drainage and percussion. The idea here is, if you see the picture of the cupped hand in the upper left-hand corner, the idea is you cup your hand and then you pat on tissue. And the idea is the concave part of your hand traps air and sends vibrations down into tissue. The little handheld things, the pink and blue thing on the top there too, are just an example of a little handheld percussor like this. You see that it's concave. So when you pat on tissue again, it's going to trap the air, send the vibrations down into tissue. And the idea is we're going to use vibrations to shear mucus away from the bronchial wall so that when you go to cough, it might be more easier for you to cough that up. Sometimes percussion is incorporated with postural drainage. And the picture here got kind of small, but you see there's pictures of a person sitting and laying in all different kind of positions. Well, those positions are very specific for different areas of the lung that we're trying to drain. And it all has to do with anatomy, right? You sit or lay in different positions so it drains specific parts of your lung. And in the old days, we used to do a lot of manual percussion in the hospital with bronchiectasis and cystic fibrosis patients. We would have them lay in all these positions, and you would use your hands, or you would use these, probably too small for an adult with bronchiectasis, but with a pediatric patient with bronchiectasis, we could use these little handheld percussors. Really, this technique can be a very effective one, especially if you are in the position where your lung disease is and it actually drains that lobe. My opinion with this is it's very, very technique dependent, right? we had a lot of respiratory therapists and nurses that were really good at manual percussion. And we had some that were okay, and we had some that weren't okay. So it's very technique dependent. But if you get a good family member or a healthcare provider that can do good manual percussion with positive drainage, can be super effective, right? The next one we're going to talk about is PEP therapy, positive expiratory pressure therapy. This type of therapy's sole goal is to kind of try to stint airways and those little alveolar air sacs open. Okay, so the one on the top, you have that mouthpiece and you would put that in your mouth, and essentially you're breathing against resistance, right? It's causing back pressure. Kind of the problem with that one on the top is that it requires a gas flow in order to make that thing work. So you see that there's like a little piece of oxygen tubing coming in there. So you either need some airflow or oxygen flow in order to make that one work. And pretty good therapy for hospital use. It might be difficult to use it at home. The one on the bottom is an example of one that doesn't require airflow. And so any type of PEP therapy that you do, again, you have to be pretty good at teaching people how to use it so that they stay kind of in the right range that you want them to stay in. How many centimeters of water pressure do you want them to stay in order to breathe against these things? Okay, many of these things can be used with your aerosol medications and without them. So it's actually a pretty good therapy, but if it's flow dependent, it might be tough to use at home. And again, education here is important because you have to be able to teach people to breathe within that certain range. Oscillatory PEP therapy. So we're taking essentially the PEP therapy now, and we're going to add some oscillations or hertz to this therapy. There's many different oscillatory PEP therapy devices out there. These are just an example of a couple. The idea here is you take the device, you put the mouthpiece in your mouth, you take a breath, and you exhale, and it causes a vibration. The big thing here is most of these devices have some sort of resistance dial or setting on them. You want to be able to breathe out, between 3 and 5 seconds on these things to cause the oscillation to occur. Other big thing is you gotta be able to seal your mouth on the mouthpiece and keep your cheeks tight, because you don't want to lose all the vibrations in your cheeks. You want the vibrations to go down into your lung tissue so that we can use the vibrations again to help shear mucus and get the mucus away from the air wall so that we can get that out. One thing with these devices that I teach people to do is to do breath holding. We talked about the importance of breath holding earlier. So if I'm going to use this device, I'm going to use the vibrations to shear mucus, but I'm also going to have people breathe in and hold their breath 1, 2, 3, 4, and then exhale, because we're not only shearing mucus away from the airway wall. If there is some lung disease in those little tiny air sacs and alveoli, we're going to do the breath holding to kind of help get the air behind the mucus and get it going forward. So if I'm using any type of oscillatory PEP device, whether it's the Aerobica, the Acapella, the Flutter, whatever, I'm going to use breath holding with it and do this technique. One of my other pet peeves with this therapy is you see folks who breathe on this 10 times and then set it on the counter. That's not how, in my opinion, we should be using it. It's a therapy. When I teach this, we do at least 6 cycles of 10. And if people are ill, sometimes 10 cycles of 10. And remember, with breath hold every time. So this is going to take some time. It's not exhale on it 10 times and then do it later. It's actually a therapy session. So people are going to use this. The one cool thing about the Aerobica device is you can actually hook your nebulizer up to the back of this and actually do a nebulizer while you're doing the Aerobica therapy, whether it's your albuterol, hypertonic saline, or whatever else you might be using. So you can actually do your nebulizer at the same time. You will lose a little bit of the medication in the Aerobica device itself, but you can do it at the same time. Now we get into some even more highly technological devices. HFCWO stands for high frequency chest wall oscillation. That's a mouthful, right? That's a mouthful. People will call this vest therapy, right? Because that's what this is. We take the little picture on the top there, the red vest, that is a smart vest by Electromed. Then going around the next one on the top is the Afflo vest. That one's kind of cool because you can see it's non-tethered or it runs on battery. You don't have the hoses. The next one on the down there on the left-hand side is the Encourage vest by Respirotech. Then the next one in the middle there is the newer one by Hillrom. That's also a tetherless vest. It's called the Monarch. And then the next one over is Hillrom, now called the vest, formerly the therapy vest. Okay, so the point of all these devices is you put the jacket on. For the Electromed, the Encourage, and the Hillrom vest, there's a bladder inside those vests. So you put the vest on, the vest inflates, it gives you a little hug. And then you use Hertz again or vibrations to shear mucus away from the airway. And then those three vests cause chest compression, where they will actually compress your chest, in effect, making you do all these small little micro coughs to move the mucus forward. Okay, so those three use the ones with the hoses in the picture use chest compression and vibration to shear mucus and move mucus forward. Okay, the non-tetherless vests also do the same thing. There's some opinions out there that these two therapies might not be as effective as the other two, but the fact of the matter is, we're going to do the same thing, give you vibrations and some chest compressions to move mucus forward. Okay, and a lot of times these therapies, when I'm going to teach people how to use these therapies, I'm going to make them do some active cycle of breathing and huff coughing or some auto drainage, as in between 5-minute settings and that sort of thing. Okay, there's some theory out there that maybe the most effective way to use these devices is to vary Hertz settings and vary pressure settings, with the idea that different Hertz target different diameter airways. Potentially, it's just a theory. Instead of using just one setting and making people do this, a lot of times we'll use 4, 5, 6 different Hertz settings for 5 minutes. Or for instance, the Encourage vest system and the Electromed and all these, the ones that have hoses actually have options where they have an automatic feature where, for instance, the Encourage vest will start at 6 Hertz and go up to 15 Hertz over a 2.5-minute period, and then go back down to 6 Hertz all by itself. So it does the full range, and then you just have folks do that, 4 times, 5 times, 6 times, however long your therapy session might be. And the other two companies that have the hoses have the same programs in them. All these companies really have pretty good customer service. One's, I can't honestly tell you that one's better than the other. Really, this is personal preference. And so they all sort of do the same thing. You can do your nebulizer treatments at the same time as this therapy. It just is a matter of opinion. Some folks like to have them do their nebulizers before and get all the, albuterol and the hypertonic saline or whatever drugs you're taking, then do the vest therapy, then maybe do some coughing at the end. I don't have an opinion either way, honestly, but what we have to remember here is now we're talking about some pretty big therapy burden, right? I mean, these therapies take 15, 20, even 30 minutes sometimes. So you have to kind of, in my opinion, walk the tightrope a little bit, right? doing the nebulizers at the same time as a vest therapy might be the way to do this if someone, says, well, I can't do a 20-minute therapy and still have to do my nebulizers before and then do all this coughing that you're telling me to do after. So you kind of have to walk the tightrope, in my opinion, and find out if people have enough time to do all this stuff. These are typically done twice a day, 20 to 30 therapy sessions twice a day. And when they get sick, maybe even more. So you have to kind of walk the tightrope with that, in my opinion. And very important, these vests have to fit properly. The non-tetherless vests like the AffloVest and the Monarch have requirements. You have to be a certain height and a certain weight. The Monarch vest actually works with these pods that talk to each other in the front and the back. So you have to meet a certain height and a certain weight, or otherwise this thing doesn't work very well. So you have to be big enough is my message with the non-tetherless vest too. I think that's all I had for vest. Now, some of the therapies that we're going to talk about next might not be quite as common, but it's worth a discussion. Interpulmonary percussive ventilation. This therapy was actually developed by Dr. Forrest Bird, and that's actually him in the picture on the top up there with his glasses, and the device sitting back behind him is actually his home device for IPV therapy. The little device that he's holding there is called the Phasitron, and the part that he's holding in his hand is actually the nebulizer cup. So now what's going to happen is you put your medicine in that nebulizer cup, and instead of you blowing out causing the vibrations, this device actually nebulizes the medication and then forces vibrations into your lungs. And oh, by the way, it also helps you stint open your airways and your alveoli while it's doing this. So then some people say, well, wait a minute. If I'm going to put this in my mouth and there's a nebulizer and it's going to make vibrations or push vibrations into my lungs, won't it actually push the mucus farther into my lungs instead of making it come out? And the simple answer is no, because the idea here is it's going to push the vibrations and the pulses through the middle of the diameter of the airway, and the mucus comes out around the edge. And it's quite a fascinating therapy, quite honestly, because you can find videos of how this actually works and see the mucus actually moving out of the airways. Just a brilliant man. He developed a lot of mechanical ventilators too. So this therapy is out there, again, probably not commonly used for bronchiectasis, and sort of one of the problems is payment for this one. There's no good code for this as far as CMS is concerned about how they should bill for this. So it gets kind of tricky to get this thing paid for. The device on the right is actually just a hospital version of the IPV, and then the one that Dr. Bird's picture with is the home version. Good therapy. Honestly, we have a real difficult cystic fibrosis patient with severe bronchiectasis that actually uses this therapy, and it works pretty good for her. So it's just it's out there, again, hard to get paid for, but pretty effective therapy because it encompasses everything, right? Stints the airways open, causes the vibration, moves the mucus, and you can do the nebulizer at the same time. Pretty new therapy out there. This technology is actually made by Hillrom. It's called Volera therapy. It incorporates CPEP and CHFO. And what that stands for is continuous positive expiratory pressure and continuous high frequency oscillation. Now, this, Hillrom markets this therapy as sort of a triple combination therapy, arguably much like the IPV therapy, where this device is going to provide lung expansion, it's going to provide oscillation, and it's also going to provide your nebulization all at the same time. Okay, so you see the picture of the young man doing his Volera therapy. He's got the nebulizer right in line with this thing, and you can do this with a mouthpiece or a mask. And you put some settings in there with the idea that Hill-Rom's sort of protocol says, we're going to do CPAP therapy first. So we're going to kind of get the airway stented open with positive pressure while the nebulizer is running. And then it's going to go into this high frequency oscillation therapy where it's going to still splint the lung open and give the vibrations to help shear mucus again and move it forward. And it sort of goes back and forth between the therapies. So it'll go CPAP, high frequency oscillation, CPAP, high frequency oscillation, or however you want to use it, all the while the nebulizer is actually running. Okay, pretty new therapy. Don't have a lot of bronchiectasis type patients on it, but just know that it's out there. The payment for this one, they're using a miscellaneous code for this to try to get this paid for. And it's not, as easy as getting a vest or an Aerobica or something like that, but we've ordered a few for different types of patients and it's been okay. And the good news is Hill-Rom kind of helps, with all that stuff. But it's a pretty interesting new therapy on the market. When you talk about airway clearance, you'd be remiss to not talk about cough assist. Now, cough assist, in my opinion, should be reserved for folks who have some kind of respiratory muscle weakness problem or, neuromuscular problem. This isn't to say that this can't be used in bronchiectasis, or maybe if someone has bronchiectasis and a neuromuscular weakness problem. But the whole idea here is these three devices, the Synclara device made by Hill-Rom in the upper right-hand corner. On the bottom, you have the T70 made by Philips Respironics. And then the newest one on the market, the Byways device, the little kind of black flat one there on the left upper. The point here is we're going to help people with their what's called peak cough flow, or the amount of flow we generate to move mucus out. Again, probably mainly for neuromuscular weakness patients, but the idea here is get somebody to take a big deep breath with this device and then physically help them improve their peak cough flow by having suction or flow coming out. Okay, so just wanted to mention that one. Probably not real commonly used in bronchiectasis type patients, but it is a form of airway clearance that's out there. Maybe an adjunct for a neuromuscular weak bronchiectasis patient. And of course, we use adjunct therapies for airway clearance, inhaled medications, bronchodilators, mucolytics like hypertonic saline. There's other mucolytics out there like Mucomyst and Pulmozyme, those sort of things. There's other inhaled medications out there like antibiotics and corticosteroids. Any of these things are adjuncts to our airway clearance. Of course, exercise. You see pulmonary rehab on there. Also, I not real well versed in pulmonary rehab. That's Christina's forte. She's the pulmonary rehab person. I've never worked in pulmonary rehab, so but you can see that it certainly is part of it could be certainly part of an airway clearance regimen. Of course, hydration is always important. The more hydrated we are, the more we can help the mucus in our lungs be more hydrated and easier to clear out. And I just need to mention the alternative medicine therapy, and not to endorse it or condone it, but please be very, very careful of things that you see in a blog or a post somewhere. Things that we inhale into our lungs that providers provide for you are FDA approved. Some of this alternative medicine stuff may not be FDA approved, so just be very careful and talk to your healthcare provider before you ever do any of these therapies, because sometimes we don't know what's in these mixtures that people want to inhale and that sort of thing. So just be very, very careful about alternative medicine and therapies and talk to your provider before you would use any of these things, please. So I'm sure I haven't, looked at the question and answer yet, but I'm sure I'm going to get a question. Well, which therapy should I use? And I put this slide on here just to my very feeble attempt to be funny, but really, I don't know. I mean, really, we should be, in my opinion, tailoring therapy to each person differently. You know, I have adult bronchiectasis patients that do vest and huff coughing, and that's all they do. I have a lady who swears by postural drainage. She literally lays on her floor with her feet on her bed and says, that's the best thing that helps me clear my lungs. Good for her. I have bronchiectasis patients that use oscillating PEP therapy. So the point here is, I think we need to tailor therapy to each individual. You know, some therapies might work better than others, right? As a matter of fact, not only should we tailor therapy, we should probably use multiple therapies. You know, we went to the CF conference in Philadelphia a couple of months ago, and all the talk was combination therapy, combination therapy, combination therapy. And you kind of heard when I was telling you about even vest use. I have people stop every 5 minutes and huff cough. If I'm using oscillating PEP, I still have people do their breath holding and do huff coughing. So I think the answer here is tailor therapy to what works for you, but don't use just one thing. Use multiple things in combination therapy, because that's probably what's going to work the best. And of course, exercise. And when I say exercise, I mean, if you're able, cardio exercise where you're breathing heavy and your heart rate's up, right? Because that type of deep breathing and breathing heavy while you're exercising is such good therapy for your, not only for your lungs, but for your overall health too, right? So exercise is super, super important. Well, wow, that's, I guess, all I have. Now we have to start trying to answer some questions, Christina.
Yes, we do. We have you.
And again, I hope, you know, I can help answer some of these questions, but I think you're going to find that some of my answers are, I don't know. We'll see what some of these questions are here.
Yeah, we do have quite a few questions, and so it probably will be impossible for Brad to get to every single question by the end of this presentation, but he's going to do as many as he can up to the hour. And so be patient as he tries to work his way down the list to maybe your question. Brad, would you like me to read them off, or did you want to go ahead and just answer them one by one on your
own? I think I'll just kind of go down the list here.
Okay, that sounds good.
Do you know Dr. So-and-so? We'll skip that one. Of course, I probably know some of these people. Yes, great pulmonologist and researcher. How can we improve our airway clearance techniques when we cannot use albuterol or levobuterol to open our airways? That's a good question. I guess there are other drugs out there. I guess I don't know the context of why we can't use albuterol or levobuterol, if it's payment or if we can't tolerate it. But, you know, there's other, you know, those are both short-acting bronchodilators. There's getting to be more and more long-acting bronchodilators out there too, right? So there's other types of HFA, MDI type inhalers that we can use, or nebulizers that we can use other than albuterol and levobuterol. I don't know if I answered that question for you or not, but I hope I did. Hemoptysis, should I back off on saline because it's making me have some violent coughing? Yeah, this is where my respiratory therapy hat, I would say that you need to talk to your provider about that one. You know, hemoptysis usually is never great, so I would talk to you about that. And just so you know, and maybe you know this, Mary, the person that asked this question, but there are different, shall we say, percentages of hypertonic saline rate. There's 3% Nebusol and there's 7% Hypersol. So if you are using 7%, maybe you could ask your provider about potentially switching to 3%. Right? The idea of hypertonic saline is we're going to breathe salt water into our lungs so we can help get more water into our lungs, right? Because water likes to go towards salt. So if you're using 7%, you would probably get more water into your airways, but maybe you could try 3%, so it's not quite so irritating, but you can still get the benefit of trying to get more water into your airways. I hope that answer helped. Do you have any recommendations of mesh nebulizers? The InnoSpire Go has been disconnected. Yeah, Debbie, this is such a good question about mesh nebulizers because, you know, the idea behind mesh nebulizers is they're actually a pretty good nebulizer because it nebulizes the particles so small, and that's important when we're trying to get medications deep into our airways, right? There are other mesh nebulizers out there. The problem I've been having with this also is payment, right? Because what is the name of the one we use here in our hospital? Oh, darn it, I'm not going to remember it, but it's really difficult to get for home use because the mesh nebulizer that we use, they didn't get, when it got FDA approved, it didn't get FDA approved for home use. So now trying to get it in the home has been very difficult. But I don't really have any recommendations on that. I honestly didn't know that the InnoSpire Go was discontinued. There are other mesh nebulizers out there. Aerogen is the one I'm thinking of, but that one is the one that's kind of difficult to get paid for at home. I'm not sure I helped you on that, Debbie, sorry. What do we do when we cough up blood? Again, Lorraine, I'm sorry. That would be a question for a provider, not for me, not for the respiratory therapist. Oh, is autogenic drainage breathing exercises available on a video somewhere? So here's what I'm going to tell you. I can't endorse any type of product because of where I work and because I'm doing this discussion and talk for the COPD Foundation. But here's what I've learned. There's actually some apps out there that honestly, I have an app downloaded on my phone that is an autogenic drainage app. And what it does is it sort of coaches you through the timing of things and tells you on the screen, okay, now do this for this long, now do this many times. Do you see what I mean? So there are apps out there. I think if you go to the App Store and type in autogenic drainage, you should be able to find it because it was very easy for me to find. Of course, I'm not going to endorse any one of these apps, but I have one lady that swears by it. She loves autogenic drainage and she uses the app almost every time she does it because it helps her sort of, it's like her phone coach, right? It helps coach her through doing these therapies so she can time these things better. Remember, this is pretty hard to teach and pretty hard to learn. So having somebody at home with you, like your phone, might help you with the timing, right? It could help. So again, I can't endorse any type of apps, but you should be able to find them in the App Store where it's like a coach and a timer to help you do autogenic drainage. I hope that helped, Margaret. As far as videos, I don't know of any videos out there. I hope that Dr. Askmet doesn't come back to me and say, "Hey, Brad, we need a video on this. So can you help us with this?" Maybe he will. It might be a good project to have, you know, on a COPD Foundation webpage or something and teach people how to do these maybe. Would you be able to demonstrate the first few airway cleans? So Pat, I think you're talking about autogenic drainage and active cycle breathing, huff coughing. Well, Pat, I'll just be totally honest with you. Because autogenic drainage is sometimes difficult to teach and for people to learn. I use active cycle breathing and huff coughing much more than I use autogenic drainage. Okay, so I think active cycle breathing / huff coughing technique is pretty easy to teach because really all you're doing is in through your nose, first slip out through your mouth, blow the candle out twice, and then on the third breath, you take the biggest deep breath you can take and hold it, hold it, hold it, hold it, hold it, and then huff as hard and as long as you can. I mean, that one's, I think, much easier than autogenic drainage. And again, I can't endorse any products or things, but there are YouTube videos out there, which again, kind of like the alternative medicine stuff, be very careful of what you find on YouTube, because in my opinion, a lot of the autogenic drainage videos, the active cycle of breathing, huff coughing videos are incorrect. There is one that I like to use. And when you type in huff cough on YouTube, you get a video. Now, remember, I work with a lot of pediatric patients too. So when you type in huff cough on YouTube, you scroll down, scroll down, scroll down, and eventually you'll find this little girl, and her name is Emily because you can hear her mother or somebody talking in the background. She must be, I don't know, 11, 12 years old. She's got a white t-shirt on and it's got a big peace symbol on it. Okay. And I use that one even for some of my adult bronchiectasis patients, because the fact of the matter is she does it almost perfectly, except that she doesn't hold her breath long enough. So in my opinion, again, these are my opinions, not the COPD Foundation's opinions or Mayo Clinic's opinions, my opinions. She doesn't hold her breath long enough, but the video is actually pretty good. There's been some discussion, not so much with Dr. Asman, but even within our own department here at Mayo, that we should maybe make some videos about active cycle of breathing and huff coughing that we can put out there on YouTube so that people can use these videos. It's kind of a, for lack of better terms, honestly, it's kind of a legal nightmare, because you put something on YouTube and then you put Mayo Clinic's name on it, and then you set yourself up for legal issues. So it's a tough thing. We're still talking about it. We currently don't have any out there, but we're talking about it, just so you know. To demonstrate the autogenic drainage, oh, Pat, I just think that it wouldn't serve anyone this time if I tried to show you how to do it, but try to find a good respiratory therapist, nurse provider that can teach you this, and use an app maybe that you can find on the App Store. It might help you with the timing of stuff. How often should I do active breathing? Yeah, that's a good question, James. I would probably recommend that you should do it twice a day. And then if you get sick, you should do it more, as long as you're clearing mucus, continue to do it. Don't do it so much though that you get lightheaded or you get exhausted, do it maybe twice a day, do 5 to 10 cycles twice a day. It might help you move some mucus. I have a lot of folks tell me that, when they get up in the morning is the worst time. Well, that makes sense, right? Because we lay flat on our back and our mucus pools in the dependent or the lowest part of our lung. And then we get up and we start moving around, and this mucus starts moving around, and then we cough and we cough and we cough, right? It might be a good idea, James, to do that active cycle of breathing right away in the morning, first thing. It could be. Again, everyone's different, so maybe try it, James, or have people try it right away in the morning. Massage gun for airway clearance. That's such an interesting question. There's no doubt that these massage guns probably would send vibrations down into tissue. But, as a healthcare provider, I can't endorse any type of therapy like that is not approved, or there's no literature out there that says this works. Do you know what I mean? So unfortunately, Will, I can't say that would work. 10 years ago, there was this therapy out there, and I think it's actually still around, where these people were trying to use sound waves. And essentially it was like taking a subwoofer and putting on your chest to send sound waves down into lung tissue. I can't remember what it was called. I think it's still available out there now, but it's kind of the same concept, right? Sending vibrations into lung tissue, whether you use a massage gun or sound waves or whatever, might work. I can't endorse it, of course, because it's not a proven therapy. Can you hold your breath for too long? I usually hold mine for 25 to 30 seconds. I think the message should be, the longer you can hold your breath, the more you might get air behind that mucus that might be really stuck in there, way in the small, tiny distal terminal bronchioles and the alveoli sacs. I think you could, the longer you can hold your breath, in theory, the more air, I guess, you could get behind your mucus. 25 to 30 seconds. If you don't feel bad after you do that, I guess it's probably okay. I just usually tell people, 5 seconds or as long as you can. So I guess in theory, Jim, holding your second longer might be better. But that some folks won't be able to do that. You know what I'm saying? 25 to 30 seconds would be way too long for some. So hold your breath so it's not uncomfortable. Aggravate bleeding again. I'm sorry, everybody. I'm not going to answer any questions about hemoptysis and bleeding. I just am not going to do it. That's a question for your healthcare provider. If you do 6 or more cycles of aerobica, do you huff cough after each cycle? So yes, when I teach aerobica therapy or a cappella therapy or whatever, I have folks do 10 in a row with breath hold every time, and then you huff cough and you do active cycle breathing, okay? So 10 in a row with breath hold every breath, and then you do your breath holding with huff cough. 10 in a row, huff cough. I usually do, when people are well, I usually have them do 6 cycles of 10 with huff coughing, and then if they get ill, sometimes have them increase it more. Again, you have to sort of tailor this. I had one guy tell me, well, I'm not doing 10. Okay, that's okay. You don't have to do 10 cycles of 10. Just do your 6 cycles of 10, but do it instead of 2 times a day, try to do it 3 or 4 times a day. So again, I think we should tailor this to people's needs, Anita, but I would huff cough after each 10 cycles, if that makes sense. So Marlene has a question in there. Can percussive vests be used simultaneously with aerobica, or do they conflict? So I'll tell you, there is a famous person out there in the CF community named Mary Lester, and she has people doing all kinds of things at the same time. And that's great. I have a lady who actually walks on her treadmill the entire time her vest is running. And I'm like, oh, that's fantastic. Keep doing it. So she's doing her exercise walking at a fast pace and her vest at the same time. So, in theory, Marlene, the aerobica and the vest both produce the vibrations. So I guess in theory, could you say kind of what's the point? Because they're both causing the vibrations to the lung tissue to help shear the mucus. Maybe. Mary Lester I went to a lecture, and Mary Lester talks about how she has people laying on a bed. They're using their aerobica, and she's doing manual percussion at the same time. So that's kind of the same thing, right? We're doing 2 therapies that essentially cause vibration. It's a hard question to answer, Marlene. Do they counteract each other? They're both providing percussion. The good news with the aerobica, you're going to get the benefit of the PEP therapy at the same time. So the vest doesn't do that for you. It doesn't give you the PEP therapy. So maybe the PEP part of the aerobica would give you some benefit, even if you're using it at the same time as the vest. again, I think if you think, Marlene, that doing the Aerobica and the vest at the same time work for you and it moves mucus, keep doing it. You know, again, combination therapy. But if you're doing this, even the aerobic and the percussion vest at the same time, I would suggest you do some active cycle breathing, huff coughing in between there sometimes, somewhere too. Do you see what I mean? I hope that answered your question, Marlene. Have you used the Volera with your patients? If so, what do you think of it? Is it effective in your opinion? You know, a Volera therapy for a specific bronchiectasis adult patient, I can't think of any. To be quite honest with you, we do use it on some neuromuscular patients that have airway clearance problems. Do I think it works? I think it probably works. I don't have any proof that it works, to be honest with you, but you know, the theory and concept makes sense to me. Stint the airways open, provide vibrations and ambulation, get mucus to move forward. I know that probably wasn't the answer you were looking for, Peter, but I hope that answered your question. Not any specific bronchiectasis patients that I can think of for Volera therapy. Oh, cleaning. You know, good question, Nancy. What do you recommend for cleaning? And, you know, let's talk about nebulizer cups too, because we should be cleaning and probably sanitizing these things. Now, there's a caveat to this. You should follow, I know this is going to be a cop-out, but you should follow the manufacturer recommendations of the Aerobica device. Monahan, who makes that Aerobica device, has specific directions on how to clean and sanitize this thing. If I remember, don't hold me to this, but if I remember correctly, the Aerobica device, you can sanitize by putting it in the top rack of the dishwasher. You can boil it. You can put it in a microwave steam bag. You can put it in a baby bottle sterilizer. These are all, but don't listen to me. Listen to what Monahan tells you. So I would be cleaning that thing, rinsing it with hot soapy water, like a mild dish soap, and making sure all the soap is out of it, and then sanitizing it on a regular basis. How often should you be sanitizing it? I don't know. I guess if I had bronchiectasis with Pseudomonas and maybe NTM, I would be sanitizing that thing at least weekly. That's what I would be doing. And that's what I tell my patients to do. You should be sanitizing it probably weekly. You know, the Aerobica comes apart in 4 pieces. And you take it apart in the 4 pieces, you sanitize it, you let it air dry, and you put it back together. And it's a great little device because you can't put it back together incorrectly. Okay, so I would be sanitizing it on a pretty regular basis. Is it possible for certain individuals that vest can be the best type? Yes, I think so. I think that, you know, vest could be the best type of therapy for some individuals, but not all. I think, again, this has to be tailored to whatever you think works for you. You know, I guess the argument, Guy and Madeline, could be that vest therapy is probably a very consistent therapy. You're always going to get the same therapy every time, right? Manual percussion, if you have the same person do it all the time and they're really, really good at it, it probably is effective. But if you're having multiple different people doing it, it could be variable, I suppose. But again, you know, I'm not going to endorse any certain type of company for a vest or endorse vest therapy only. But I think it's a pretty consistent therapy. Is it okay to use the app, Autogenic app? Wow, yeah, again, I think anytime you can combine therapies together, use the app while you're doing autogenic drainage and, you know, do some active cycle breathing at the same time, huff coughing, do all the stuff together at the same time. I think, again, combination therapy is so important. Don't just do one thing, do multiple things to help you get this mucus cleared out of your lungs. Nebulizer, green acapella. My lungs don't feel congested. I wonder. So is the hypertonic saline getting through the acapella? That's a really, really good question. There's no question, Karen, that you might be losing a little bit of the medication if you're using your nebulizer at the same time as the acapella. Or the Aerobica, whichever one you're using. But again, you know, maybe you should try to incorporate some breath holding with your therapy and huff coughing after so many rounds of your acapella or aerobica while your nebulizer is running, and see if that might improve your airway clearance. Okay.
Brad, well, I'm gonna let you take one more question and we're gonna wrap this thing up.
Yeah. Let's see. Could have asked. Yes, so you know, we didn't talk about, Anna asked a question about the cost of the vest. Very expensive. You know, even you could maybe say ridiculously expensive. These things are expensive, and there's no question they are. Airway clearance in the vest, it's going to be expensive, and sometimes insurance companies balk at the fact that they don't want to pay for this therapy. It is very expensive. There's no question. So would it be the first therapy pushed to a patient as far as vest therapy? How do I choose a vest? Oh boy. This is a very good question, Anna. I honestly, when I see patients, I actually have every vest that you saw on that one slide. I have the Hillrom vest, I have the ResProtect vest, I have the Electromed vest, I have the Apple vest, and I have the Monarch vest. And people, I kind of joke around with people that when someone wants me to start a vest, I go in there with all my stuff, and it's the dog and pony show. I have so much stuff that I bring in, and I kind of go through each vest with them. And, you know, because I work at the Mayo Clinic, I can't say that one vest therapy is better than the other. But we let people sort of pick. I'll be honest with you. The non-tetherless vest, the Apple vest, and the Monarch vest, even Hillrom will tell you that the Monarch vest probably is about 60% as effective as the, you know, as their 105 model. So I'm a big believer in these non-tetherless vests that run on battery are great, but probably the ones that have hoses are probably a better therapy, maybe. I can't say with certain, to be honest with you, because remember, there's not a lot of literature out there that says that anything that we talked about today, one is better than the other. So I don't have a preference of a vest. I honestly let people pick one. Now, in our institution, we probably use one particular company more than the other. And quite frankly, it probably is because that's the one we own in our department, not because it's better. Do you know what I mean? Because we can't train 200 respiratory therapists on 5 different vest systems that we're going to use inpatient. So we have one. And so that's just, and I'm not going to tell you which one we use. It doesn't matter. One's not better than the other. So they all have hertz, they all have pressure, they all do the same thing. Now, each company has their, I like to call them marketing ploys that try to tell people that one is better than the other. But honestly, when you put these on, they all do the same thing, right? I can't tell you that one's better than the other. I'm so sorry we didn't get to everyone's questions.
I knew we have a lot. I think we had a record number of questions, a record number of registrations. So we're gonna, I would love to have you back again, Brad, to speak again, because I think we'll have just as much participation and attendance as we did at this event. And I thank you so much for being here and providing your expertise and, you know, providing knowledge to our community, because this is a hot topic and they're actively involved in their airway clearance every single day. And so we just really appreciate your time. And I also would like to thank everyone for joining us today. If you aren't a member, we encourage you to join Bronch and NTM 360 Social Community. We welcome patients, caregivers, and healthcare providers to join our community and keep the conversation around bronchiectasis and NTM lung disease going. By joining Bronch and NTM 360 Social, you will not only become a part of an amazing community, but you will receive monthly newsletter to keep you updated on future educational and social events and potential research opportunities. I invite you to post any of those unanswered questions from today's event into the activity feed of Bronco NTM 360 Social. Our community loves to engage and provide support to those who wish to learn more about their diagnosis. And just remember, join us in supporting World Bronchiectasis Day on July 1st. We thank you again, everyone. Thank you, Brad, and say our goodbyes.
Thank
Bye,
you, everybody. So sorry I didn't get to everyone's question.